I'm Sam King.
Christina Garcia.
Sarah Gray.
Elizabeth Johnston.
We're going to be talking today a little bit about epidemics in Africa. Here recently in Sudan, there's been 40,000 people displaced from their homes. They've been displaced by civil war and unrest. It's nothing new to the region, but it's a serious problem, considering that these 40,000 people end up having nowhere to go. There's been drought preceding this, and then there's been floods. And so these people are not catching much of a break at all. They're moving from northern Sudan towards the southern area of the region. It's, like I said, about 40,000 people. And there's just there's no place to house them. They have nowhere to go. They're moving into refugee camps that are equipped to hold 20,000 people tops. And at the current rate they're going, according to the American Red Cross, that 20,000 people are going to run out of water in about a week. This isn't something that's generally specific to Northern Africa by any stretch of the imagination. All across, from east to west in Southern Africa, they've been experiencing food shortages, largely due to one of the worst droughts areas seen since in known history. Recent rainfall just hasn't been happening the way it should be, and there's hundreds of thousands of families throughout the region that aren't able to grow enough food to even feed their families. Everything's failed for them. They can't get wild game like they once could. The crops are failing like they didn't used to. The drought, the famine, that isn't the only problems we're looking at here. We have deeper issues than that. The diseases in Africa are rampant as well. You know, we're not just talking HIV, we're also talking Ebola, we're talking hemorrhagic fevers. And one study done by the National Institute for Disease Control cites that there were at least 7 outbreaks of Ebola in Southern Africa alone within the previous 6 months. And that's just the ones they picked up on. That isn't including ones that happen out in the bush that they're largely unaware of.
Okay, so we must end world hunger in Africa formally before it gets worse to help the many cubs of Africa to stay alive and to flourish. With the amount of abundant resources that America has, you would think that the rest of the world would be up to par or even better. In many homes, other countries of Niger, Mali, Ethiopia, Kenya, and South Sudan suffer with no electricity, heat, or even clean running water. The insufficient amounts of water that are available oftentimes are dirty and full of filth from their original locations, whether it be well, stream, or pond. More than 30 million kids and grown-ups throughout a band of Africa experience a demoralizing hunger crisis. Deprived rainfall, crop failures, and increased rapidly food prices have made it quite tough for individuals to afford nourishing foods for their offspring and their babies. Right, healthy foods put children of Africa behind in their progression and growth. It is said that more than 25% of Malian children are underweight, making them vulnerable to the hunger crisis. Most of the children are fighting every day for their lives due to the starving hunger crisis. Approximately 80% of sickness in developing countries in Africa is connected to unfortunate poor water and hygiene situations. In Africa, the population devotes roughly around 40 billion hours each year just walking alone in searching for good drinking water. Women and children typically tolerate the problem of water gathering. They simply walk miles and miles to the nearby bases of water, which is exposed to filth and more than likely is the bizarre cause that is making them sick. It is stated by Margaret Catley Carlson, the Vice Chair, World Economic Forum at the charitywater.org/whywater, that water is an astonishing, complex, and several force in an economy. It is a single constraint on the expansion of every city, and bankers and corporate executives have cited it as the only natural limit to economic growth. With non-toxic water closed, ladies are unrestricted to new opportunities and can expand their families' lives. Kids would be able to make an education for themselves and shape the upcoming other societies. Consequently, this epidemic continues to cause a decrease in the ever-changing declining population in the countries of Africa. Clean water and abundant amount of healthy foods doesn't just save lives, it changes them endlessly.
The mortality rate in South Africa has more than doubled since 1985. In 2011, the birth rate was about the same as in 1985, but the number of deaths had more than doubled. The Institute for Futures Research projected that a mortality rate increase of 17% would happen between 2010 and 2040. These deaths mainly caused by disease and malnutrition. There are multiple ways that diseases can be spread. One of these ways is by insects. Insects spread malaria, yellow fever, and dengue fever. Food and water also transmit diseases such as cholera, hepatitis A, parasites, and typhoid fever. Intimate contact can also transmit diseases such as AIDS or HIV and hepatitis B. If you go to library.thinkquest.org, there's good information about the different vaccines that they give to travelers before entering the country. And this site also explains what regions each disease is most prominent in. Unfortunately, a lot of these diseases occur among children. Every day there's an estimated 21,000 children under the age of 5 that are dying. Malaria, which is an infectious disease transmitted by mosquitoes, kills an African child every 30 seconds. Malaria is a preventable disease, and there are many different drugs that can prevent this disease, but they unfortunately aren't readily available. Another very unfortunate cause of death is HIV or AIDS. In 2008, more than 1.4 billion African children were killed under the age of 5 from HIV or AIDS. Most children contracted this from their mothers during pregnancy, birth, or breastfeeding. Others were exposed to or contaminated to needles or blood. Some food and water contain parasites, which can lead to diarrhea. In America, we don't really think that diarrhea is a very big deal. But for children in Africa who are already malnourished and have other diseases and infections, it can cause them to dehydrate, go into shock, and then die. And many children in Africa never reach their birthdays due to these different diseases. There is, of course, a large mortality rate for adults as well as children. HIV is a very big cause of death for adults. In 2004, the percentage of pregnant women with HIV was 30%. The average time from becoming HIV positive and death is about 8 to 10 years. However, HIV isn't the only cause of death among adults. There's still, in fact, a high death rate due to malaria and other diseases we've already spoken about. Africa already has high death rates from unnatural causes as well. Homicide is a very big deal for Africa. They have the second largest rate of homicide. Colombia has the first. Just to give an idea about survival, how hard survival is in Africa, according to the World Health Organization, or the WHO, the average life expectancy in Africa is 52 years of age.
Okay, the two major causes of death in Africa are from disease and malnutrition. Disease can be transmitted through insects, intimacy, and parasites in food and water. Many of the homes don't have electricity, heat, clean water, and medical supplies already available for them, so the death rate is increased because of that. The food and water crisis is the leading cause of death. There are 80% of sicknesses are due to poor water and poor hygiene. More than 30 million kids and adults have suffered from hunger because of this, because of crop failure, because of lack of rainfall, and high food prices. It's not like here in the U.S. where it's an abundance of clean water that is readily available whenever we need it. It is often contaminated and dirty from wells, stream, and ponds. One of the most common diseases transmitted from insects is malaria. It affects children and adults, killing one child every 30 seconds. HIV and AIDS are also transmitted through intimate contact, and more than 1 billion African children have died from it already. Most of the children who die from it come in contact with their mothers during pregnancy, birth, or breastfeeding. Nearly 30% of the pregnant women have HIV that are in Africa. Many of the children don't even reach their 5th birthday. Parasites that are found in food and water lead to diarrhea, malnutrition. Because of the malnutrition, it leads to dehydration, shock, and then ultimately death. But it isn't just happening in Africa, it's happening all around the world. It is important to realize how lucky we are living in the United States with all the food, clean water, and medical supplies that are readily available for us. It is important to bring awareness to this ongoing program and to try and get involved to help the less fortunate. The Water Project is one of the many organizations that is dedicated to bringing clean, drinkable water to those who need it. There are organizations like this dedicated to providing clean water, food, and medical supplies that bring sustainable living to people that are less fortunate. It's our turn to reach out and make a difference. Fine.